Dr. Jackie Blue.
Mr. Speaker, it gives me great pleasure to speak in the general debate this afternoon. Shortly we'll have Budget 2012, and that will show that we have a steady and sure path back to surplus by 2014-15. It's so important we return to surplus. We are one of the most indebted countries in the world. We need to pay our bills, we need to get back to surplus, we need a buffer for the next global impact when it comes. Not if, but when it comes, as it surely will. The budget will have a balanced approach, very similar to the previous budgets by this government. There will be entitlements to welfare and superannuation, but we'll be investing more in health and education and law and order. I want to spend some time talking about the health sector and congratulate our Minister, the Honourable Tony Ryle, for his focus and his belief in the health system. It has paid off. The Honourable Tony Ryle is very determined to increase productivity in our hospitals, and today, by chance, there was a report from the New Zealand Herald where researchers from Victoria University, independent research, has confirmed over the last 3 years hospital productivity has increased between 3 and 5%. That does not surprise me one bit. This is evidence-based research. It does not surprise me one bit, because we have had a minister who has believed in the health system, has gone around the sector, talked to people, made some minor reforms, and it's working. We have had huge inroads in the increase in elective surgery, a staggering 27,000 more than were done in 2008. Record levels of immunisation. Mr. Speaker, immunisation for 2-year-olds has gone from 73% under Labor to 92% under National. It's phenomenal, the improvement. We have now set a new and ambitious target of 95% of all 8-month-olds to be fully immunised by the end of 2014, and I'm confident we will achieve that target. We've had huge progress in cancer waiting times. In my first term of Parliament, we had women going to Australia for radiotherapy. We had blowouts of waiting times for radiation. There were blowouts everywhere in the cancer waiting journey. That has changed. We have now the gold standard of a 4-week waiting time for radiotherapy. That is phenomenal. People probably said it couldn't be done, but we did it. The Minister has done it, our DHBs has done it, they have delivered. Mr. Speaker, shortly that 4-week waiting time will be extended to chemotherapy waiting times, and I'm very pleased to see that. There's something about having targets, and it sets the mind, it focuses the mind, and the DHBs have welcomed the targets which are published quarterly. And you'll see that it's lifted the game. There's variable results, some are good in some areas, others not so good, but over time everyone has stepped up. It's not threatening, it's been a challenge, and it's improved productivity in our system. A new toolkit has been released by the Minister to district health boards to help improve productivity. And you know what? It's not rocket science. It's about sharing great ideas, supporting colleagues, and improving the system. It's about improving simple things like improving theatre scheduling or post-op surgery to get people back on their feet quicker. It's sharing good ideas amongst the DHBs. That's one part of the toolkit. And I think that, let's face it, greater work satisfaction, better results are all part of colleagues sharing information, supporting each other, and you get greater outputs, and it's shown. I'm particularly pleased, Mr. Speaker, with the Prime Minister's youth mental health package funded by Vote Health to the tune of $33 million over the next 4 years. And this includes $10 million to school-based services, which really means now there will be a nurse in every Decile 3 secondary school, in addition to the nurses that are already in Decile 1 and Decile 2 schools. This will cover 157 secondary schools, and 56,000 young people will be catered for. I think that's a fantastic start. It's about $2.7 million into e-therapy, particularly for young people who aren't ready for a face-to-face consultation or help, and that e-therapy, the new way of media, will be one way of connecting with those young people. It's about $11.3 million into expanding primary care for youth. But as Rheumatic fever announcements recently, fantastic. Look, it's a third world disease. We shouldn't have it in New Zealand. Labor did nothing for 9 years. Last year we had some announcements. I'm delighted with this package. Thank you.
The Honourable Trevor Mallard.
Mr Speaker, I want to make a couple of comments to members.